My name is Peter, and we have XLHED, so X-linked hypohidrotic ectodermal dysplasia.
This is my dad. I'm Beth, and my son has X-linked hypohidrotic ectodermal dysplasia.
My grandfather had it, and as far as we know, it probably goes back at least 150 years, so we can trace it back to Scotland. So when I was born, it was a surprise to my mom. She didn't really know anything about it.
As I was getting older, we started having conversations about XLHED, and if he has it, it means I'm probably a carrier, and kind of implications for me having children. When I first decided to start considering starting a family, I reached out to NFED for genetic testing. We needed actual genetic confirmation that this is truly what we had, so they helped me find a provider for that. And then when I first got pregnant, they helped me navigate who do I need to go to get genetic testing for my baby. And then when the testing came back positive for XLHED, they put me into contact with Dr. Grange.
I have one of the sites at Washington University. There's now 8 sites around the world, 2 in the US and 6 in Europe. And we're kind of in the middle of it. We're up to 12 subjects enrolled now, with the goal of getting between 15 and 20 boys treated prenatally.
Of course, we worry about, are there side effects we don't know about? Is it even gonna work? We considered a risk versus benefit, but as we learned more and we read more, we got more comfortable with the idea that, this is showing some really good results in other babies.
We're actually able to now do this clinical trial, and it's such an opportunity to be involved with the development of this really new kind of drug.
And that is an opportunity that is very special. We think about it, it's been in our family for 150 years, and now there's hope. It's pretty incredible. Matthew's pediatrician reminds him at every well check that he's changing the future.
I have 3 sisters, and I have no idea even today if they're carriers. I have a daughter, Beth, who we thought might be a carrier, but we only know what we know because of the NFED, right? The resources that they made available to us to help our wives and our daughters understand ectodermal dysplasia, be able to be prepared, be able to have a conversation with their boyfriend or their fiance or their significant other.
Contact NFED and ask those questions. The resources are there. Participating in a trial is, of course, a personal decision, but I certainly don't have any regrets.